Hey, welcome back. My name is JT Weatherford. I am a certified pediatric emergency nurse. We're going to be talking about medication calculations today. How do I calculate all these medications? It is so confusing. Hopefully this is going to help. I saw this posted on a question on a Facebook group. Meg, this one's for you. Hopefully this will help you understand a little bit better. And I know you posted back in August, so hopefully by this point you've kind of gotten a much better grasp on it. But we're going to kind of go through some basics on this so that hopefully just kind of helps reinforce it. So here's the question that was posted on this group. So you have a 2-year-old child that comes in that's on the pediatric nursing unit, has an oral temperature of 102 degrees Fahrenheit. So they do have a fever. The doctor has prescribed acetaminophen, 130 milligrams per oral PO now for the fever. The child weighs 22 pounds. The recommended dose for acetaminophen is 10 to 15 milligrams per kilo per dose every 4 to 6 hours. Then the questions on here that we need to figure out is what is the child's weight in kilos rounded to the nearest tenths? What is the lowest therapeutic dose in milligrams? What is the highest therapeutic dose? And then is the dose that the doctor ordered safe? Then I'm going to take it even a step further. So at the bottom of this picture, you can see the concentration on there for acetaminophen. This is a pretty standard concentration, 160 milligrams per 5 mLs. So how many mLs are we going to give at the very end on there? So, all right, let's dive into this and kind of see if we can't work through this and then also do some other ones as well. So what I have on here is, let me make sure, okay. Sorry, I had to make sure I have my calculator up too. So we're going to get some math going here for you guys. All right, so what we're going to do is the acetaminophen is up here. You've got the 130 milligrams. That's what the doctor ordered right there. Then you've got the weight is 22 pounds. The normal dosage ordered is going to be 10 to 15 milligrams per kilo per dose. This is pretty standard across the board. I haven't seen it anywhere where it changes at all for this. I think acetaminophen, that's just kind of their standard dosing for that. So this is something that you would find like in your drug formulary. For me, I use Lexicomp. That's one that's a pretty common one in my facility that we use. There are a bunch of other ones out there. Whenever I have nursing students, I make sure to tell them that they use that facility's drug formulary, because like for mine, it can be very specific and there can be some variances when you start getting to some of the other medications like antibiotics, drips, and those kinds of things like that. Acetaminophen and ibuprofen are very similar. So they don't fluctuate much at all is what I mean there. So it's going to be that 10 to 15 milligrams per kilo per dose for acetaminophen. Ibuprofen or Motrin is 10 milligrams per kilo per dose. Okay, now I got that out of the way. Okay, so the first thing that we need to do, we need to figure out what this child's weight is in kilos. So we need to figure out how to go from pounds to kilograms. And that's your very first thing that you need to do. Once you figure that out, then you can start figuring the rest of it out. But this is the very, very first thing that you need to do. And ideally at your facility, if you have kids, everything should just be weighed in kilos. Your scales and everything should just automatically be kilos. Don't have them change it to pounds, because that's when errors happen. We had a kid that came in that we had a scale that we didn't know had changed to pounds. It was an error. And then they ended up dosing the kid based on pounds. This can cause lots of medication errors. There are 2.2 pounds per kilo, and that'll get you on that there. So that's the one that you need to memorize. 2.2 pounds per 1 kilogram. So the way I write it out is like this. So I write out what I have on there, what I know, what do I need to get to. So I know that I have 22 pounds and I need to get 2 kilograms. So then, little dimensional analysis. We're going to write a little fraction. This is where you cancel things out on here. So you have your 22 pounds over 1. This just kind of helps me so I keep track of all my units and conversions and everything, make sure everything gets canceled out. When a unit is on the top and then on the bottom on your next fraction over, that's how you cancel out. And that way you know which way to flip-flop your fractions and stuff on there. You can put them either way. So I could put pounds up here, kilos down here, but then it's just going to mess up your math and stuff. It doesn't matter which side you want to put it on. Like I could even put 1 over 22 pounds, and then as long as I have the pounds on the top on the next part and then kilos on the bottom, that'll still cancel out. Hopefully it makes sense as I move along here. So what I want to do is put my units on here. So we're going to go pounds down here and then kilos up here. So that way I end with kilos on top. That's my goal, is whatever I start with, I want to end with this over here. So I start, I want to cancel everything out that I don't need. Then at the very end, I want to end with that at the very top of my fraction there. Hopefully that makes sense. So then I know that per kilo, so 1 kilogram equals 2.2 pounds. Hopefully that makes sense on there. So then now all you have to do is do math across there. So you're going to multiply the 22 times the 1 divided by this 1 times 2.2. So then you'll come out to, it'll be 22, just erase that, 22 divided by 2.2. That should be pretty simple on there. So then when you do that math, get out a calculator, especially as you start getting into some other, this is fairly basic, but as soon as you start getting into some more complicated math, definitely pull out the calculator. Don't be afraid to use that. So then once you divide that, that's going to give you 10 kilos. So now that you know how much this kid weighs in kilograms, now we can figure out the therapeutic dosing, and then what your dosage is, the high and the low on there. So when they say lowest therapeutic dose, this is what this is talking about here. You want to talk about, so your 10 milligrams per kilo per dose, that's your lowest. 15 is going to be your highest. So then what we need to do, so what do we know? We've got 10, we have 10 milligrams per kilogram per dose. So then we're trying to get to how many milligrams per dose. Same with this one here. I'll go and put that in there. So then now what we need to do, so we've got 10 milligrams per kilogram per dose. What are we trying to cancel out? Right, you just need to get rid of the kilograms. So how do we get rid of the kilograms? We're going to take this 10 kilograms and somehow plug it into here so that way we cancel out the kilograms. So to just make this a little easier, since we're going to keep the dose on there, we can just kind of erase that off of there. And let's do this. So because we have dose on there and dose over here, I'm just going to erase it so that way it just kind of makes it a little less cumbersome with trying to keep track of units on there. So all we've got is 10 milligrams per kilogram. Okay, so that's my fraction on there. So I know that I need to go 10 milligrams per kilogram to milligrams. All I got to do is just cancel out that dose on there. Here, we'll get rid of this as well. Just to hopefully make so it's not super confusing on there. So then we go, what do I've got? I've got 10 kilograms up here. If I just simply multiply it by 10 kilograms, that's going to be 10 over 1, right? So that doesn't matter on there. Then I can just multiply across. My kilograms cancel out because they're on opposite sides of the fraction there. Then 10 times 10 equals 100. 100 milligrams. So that's your lowest on there. If the doctor had ordered a dose of 80 milligrams, you'd be questioning as to whether he made a mistake or whether they got dosed already. That's another common one, is that the kiddo already got dosed, and then they're just kind of trying to make up for it there to make sure that they get into that therapeutic range there. A lot of the parents will underdose this, and you can kind of see how the math is a little complicated. Just the more you do, the easier it gets. So I hope that as you do more, this makes more sense, and just it takes practice on there. So then after you do your lowest dose, then you need to find out your therapy, the high end there. So that way they don't overdose the kiddo. So that's where this 15 milligrams per kilo per dose comes in on there. So that's what we're going to put in down here. So just like we did up here with the 10, we're going to do 15. Move my mic out of the way so you can see. There we go. So we're going to do 15 milligrams per kilogram. Okay. Now, what do I need to get rid of? Right. I need to get rid of the kilograms on there. So how do I do that? Multiply it by the 10 kilos that we got earlier. So again, 10 over 1, just to make sure that your units are in the right place and everything on there. So then your kilograms cancel out, and then you're going to be left with milligrams on there. So then 15 times 10 is 150. So you can give that kid, this kiddo can get a range of this medication from anywhere from 100 to 150 milligrams. So then they're not underdosed, and then they're not overdosed on there. So then what was the order that the doctor gave? Right, we did 130 milligrams. So then the question is this order a safe dose? Does that 130 milligrams fall into that range of the 100 to 150 milligrams? And the answer is yes, it does. It absolutely does. So therefore, it is a safe dose. Hopefully that makes sense on there. Let's go over to the concentration on here. So again, back to this picture on here. The 160 milligrams per 5 mLs. How many milliliters am I going to do on there? Erase some. Okay, back on the whiteboard here. I erased that bottom part off of there, the high dose there. So we've got, what do we know? We've got 160 milligrams per 5 milliliters. We know that. We also know the dose, the ordered dose. Let me get rid of my towel. The ordered dose is 130 milligrams. So the way I write it is I write my dose first. What did the doctor actually order? Now that I know that it's a safe dose and I'm not going to underdose or overdose the kid, what did the doctor order? The doctor ordered the 130 milligrams. So I'm going to write that on here. Okay. Then I add in my concentration. What is my concentration? Well, that's back on this picture over here. At the very bottom, it says your concentration is 160 milligrams per 5 milliliters. So we're going to write that over here. (160 milligrams per 5 milliliters). And then you're going to multiply. However, hold on, you're not quite there yet. So you can't just multiply this 130 times 160 and then divide by 5. That's not going to give you the right answer, because then you're still left with milligrams squared over milliliters. That doesn't work because your units need to cancel. You need your units opposite each other on there. So if I do another fraction over here, just throw 1 on there, my milligrams are right in line with each other and the milliliters are on the bottom. And what do I need? At the very end of the day, I need to know how many milliliters I have left on there. So instead of doing it this way, we're going to erase this, the concentration on here. Just flip your fraction around. So 5 mLs over 160 milligrams. I can write a G there. Okay, so now you can see, and this is a good final check before you do your math across to kind of see if everything's going to line up. So since these are opposite each other, milligrams cancel out. Then you're left with milliliters. And that's what we want at the very end. So perfect. So now then you can multiply 130 times 5, 1 times 160, and then you'll divide that 130 times 5, whatever that number is, divided by the 160. So let's do a little math here. Go and pull out your calculator here. So 130 times 5 divided by 160. What'd you get? Yeah, so it's going to be 4.0625. The best way with this one, it's not like another one that I'm going to do is fentanyl, where you got to get really close to the tenths, even hundredths on there. But with this one, Tylenol, it's totally fine to round up. You round it to 4.1 would be your final answer on there. Cool. Hopefully that makes sense on there. All right, so let's do another one. So with this one, we're going to look at fentanyl. The more you do, the better it gets. I promise. It takes a while. I remember I really struggled with this when I first started, and that's okay. And that's where you have somebody just kind of helping you with it as well. Don't forget that. You have a team that's going to be there to help you. Especially when you start getting into these opioid medications, you want to have those double checks. At my facility, we have to have another nurse check it with us to make sure our math is correct. And when I very first started, I was so nervous that I was even having nurses double check my Tylenol, ibuprofen, Zofran math as well. And that's totally okay, because I get it. This is very complicated. And you want to make sure that you get this right, because you can cause severe adverse events, adverse drug events, if you do get this wrong. So just slowing down, taking a breath, making sure you're walking through it step by step. And that's totally fine. And you'll get there. And it takes time. Now that I've done it for just a little over 10 years, actually been in medicine 15 years now, nurse for 10 years, but the math comes easier, and I can do some of it in my head sometimes. Like Tylenol or ibuprofen. Ibuprofen's 10 milligrams per kilogram. 10 times 10 kilograms, that's 100, and that's easy. But when you start getting into micrograms, especially when you start getting your drips and going micrograms per kilo per minute, those are the really complicated ones. I'll do a separate video just for that, because that's going to take a while to kind of walk through those ones. So for fentanyl, I wrote a couple different ones on here. There's the IV version. We'll talk about that one first. Then, sorry about the glare, the intranasal version. So when you're doing this is kind of the point of this, to show you the two different ones, because you can see on here that your dosages are going to be different, whether you're doing IV or you're doing intranasal on here. IV is 0.5 to 1 microgram per kilo per dose when you're under 50 kilos. When you're above 50 kilos, it's just a standard 25 to 50 mics per kilo, or mics per dose, sorry. And then when you're doing the intranasal, it's 1.5 to 2 micrograms per dose per kilo. Oh, I forgot a spot on there. Per kilo per dose. I'll write that in there. Per kilo per dose. So the point of this is just to make sure you know which route you're giving it in, because you can have some variations. When you go to look at your drug formulary, you want to make sure you're looking at the correct one. Antibiotics are notorious for this. It's like, are you giving antibiotics for appendicitis, prophylaxis kind of thing? Are you giving it for ear infection? Are you giving it for gastroenteritis? Although that depends. Anyways, I digress. You just want to make sure that you're giving it you're looking at the correct reason that you're giving it, the right indication, right? That's part of your rights, your medication rights. Okay. Doctor ordered 25 mics on there. Well, there's a bug flying around. 25 mics of fentanyl, IV. He wants it IV for this one. Your patient weighs 66 pounds. Okay, what's the first step? Right, we need to convert that to kilograms. Okay, do you remember an easy way to do that? So, we'll start up here. What do we got? What do we know? 66 pounds, right? What are we trying to get to? Kilograms. Yeah, cool. Okay. So then we'll do our fraction here. We want pounds on the bottom because we want to cancel that out. We want kilos on top because we're going to end up with kilos over there. So how many pounds in 1 kilogram? Right, 2.2. Perfect. All right, can you do that math? 66 divided by 2.2. What'd you get? Good, 30. Perfect. So now you know how much your kid weighs in kilograms. So then the best thing to do, so you don't mix it up, just completely erase that. And put that up there. Now you have your kilograms. And there's not a chance that you're going to do your calculations with in pounds. Because remember what I was saying, you don't want to do it in pounds because you can get some major errors in there. Can you imagine, especially with this, can you imagine multiplying at 66 pounds versus 30 kilos? Because that's just a straight 1 microgram. You're going to be more than double of your dose. So that's why I stress it's super, super important. Also making sure you know where your decimal point is at because you can 10x your medication very, very easily. Epinephrine is a very simple one that you can you can 10x your dose, and that would be detrimental and could kill a kid if you're not careful. So just not to scare you or anything, but really, really make sure you know where your decimal point is going. Same thing with your weights. Make sure it's always in kilos. Cannot stress that enough. Okay, so we need to figure out, so 30 kilos, under 50 kilos, right? So we're going to use this one here. If he is over 50 kilos, then we just have the standard dose of the 25 to 50 mics per dose. And that's going to be purely provider dependent, whether they do the 25, do the 50, or do some combination in between there. Okay, so since they're under 50 kilos, let's erase this. We don't need this. Just less confusing on there. Okay, so we need to figure out your therapeutic dose range there. Is it a safe dose? That's what we need to figure out first. So they weigh 30 kilos. Our range is anywhere from half to 1 microgram per kilo per dose. Okay, so what do we know again? So we know that we have our concentration, 0.5 micrograms per kilogram. And I'm just going to leave dose off on there because we're only doing 1 dose, right? So then it's kind of redundant to keep it on there. Just for simplicity, we're going to take it off on there. Okay, so we've got the half. Now then, we're trying to cancel out the kilograms. So we need to put kilograms somewhere over here on our other fraction, right? Do we do kilograms on the bottom or on the top? Where's my kilograms over here? Right, so they're on the bottom. So in order to cancel, it's going to be on the opposite side. So it would be on the top over here. So we're going to write kilograms. We'll just write the units first, and then it's just going to be 1 down there. And then you're going to put in your weight there. So 30 kilograms, and then you just check to make sure, yep, cancels out, cancels out. We're left with micrograms. And does that make sense? Yeah, because we want micrograms left over at the very end. So then all it is simple math of half. What is half of 30? Right, so 15 micrograms. Okay, now that's not that's not what the doctor ordered. He ordered 25. So then we need to see, well, am I in the right range there? But we're not done yet because we just did the bottom end of the range. We still have up to 1 microgram per kilo per dose. So then down here, same thing, we're going to do 1 microgram per kilogram. And then again, same exact setup, 30 kilograms over 1. So your kilograms cancel out. And then it's just simple 30 times 1 on there equals 30 micrograms. So your range that is a safe dose range for this kiddo that's a 30 kilo kiddo is 15 to 30 micrograms. So then the doctor ordered 25 micrograms. Does that 25 micrograms fall into between that 15 to 30 micrograms? And yeah, it does. So you're fine to give that medication. So you know that it's a safe range. You're not going to underdose and you're not going to overdose. That's the way to look at the safe ranges, the therapeutic low and the therapeutic high. Are you going to underdose or are you going to overdose? We don't want either. We want it right in between in that sweet spot there. And so that's where you're going to get that there. So then you just look at that to make sure that it falls into that range on there. That's all that is. Then when you go to figure out how much you're going to give, like your milliliters, then that's when you have to do your ordered dose times the concentration, which I'll do that in a second. But what I want to do first is just show you the difference with an intranasal version versus the IV version here. So then, again, we have our range. Oh, sorry, back up one thing here. So max doses as well. You want to make sure that they don't go over the max dose. So if this dose was ordered at 60 micrograms, but then you go into Lexicomp or into your drug formulary and see that it says 50 micrograms as your max dose, you need to be talking to your doctor, your provider, to kind of see like, hey, I'm having 50 micrograms as my max dose. Why are we doing above that? They do max doses on here because it can be harmful to the patient, and we don't want to do any harm to our patients. So we always want to check that it's like, okay, yes, we're in the therapeutic range, but also am I maxing out on my dosage on there? So then an example would be a 60 kilo kid. You're not going to give 60 mics because your max dose is the 50 mics on there, if that makes sense. Okay. So your max dose on this one for intranasal is 100 micrograms per dose. It takes more to get absorbed when you're in the intranasal than you're in an IV. If you do IV, it gets absorbed so quickly and so fast, and its effect is very quickly. I think the peak effect is like within 5 to 10 minutes intravenous. With intranasal, I think it's like 10 to 20. I'd have to double check on that, but it's somewhere in that range there for fentanyl. Every drug's going to have a different peak effect on there. So you want to kind of monitor your patients as well, knowing that when they are going to have that peak effect as well, and knowing when to reassess pain, for example, for fentanyl. Or like with acetaminophen, you want to reassess a fever in an hour because it's going to take about an hour before you're going to start seeing that fever coming down on there. Okay, so back to the drawing board here. So we've got 1.5 to 2 micrograms per kilo per dose. That's your range. That's what you got from Lexicomp or your drug formulary. Then you got to figure out, well, did the doctor order the 25 mics? Does that fall into that 1.5 to 2 micrograms per kilo? Don't know, right? So we need to do the math to find out. Okay, so it's going to be the exact same setup like up here. So you're going to have 1.5 micrograms per kilogram times, what do we need to get rid of? The kilograms. Yep. So kilograms, how do you get rid of it? We need to cancel it out. We need it on the opposite side, diagonal from that. So we're going to have kilograms over here. And then we're just going to have 1 there. So our weight is 30 kilograms. All right. Then you're going to multiply it. So 30 times 1.5, right? And you end with your micrograms over there. So 30 times 1.5 is 45. Okay. I see a concern already with if the doctor ordered 25 mics and my low end is 45, I'm going to ask the doc, well, first I'm going to do the rest of my math to make sure everything's correct, but then I'm going to be asking like, hey, this is a low dose. Are you sure you want to do just this here because it's not going to work? Okay, but before we go asking, we want to double check all of our math and everything, right? Okay, so we have our range, 1.5 to 2. So then the next one is 2 micrograms per kilogram. And then same thing, we want to cancel out our kilograms, so 30. So then 30 times 2 equals 60 micrograms. Right? Did you see how I did that? So same thing as this one, just switch that over to 2 instead of 1.5, then multiply 2 times the 30. And then that gives you your total, that gives you your therapeutic range there, your safe dose. So when I look at that, I'm like, okay, 45 to 60 micrograms. I'm wondering, I'm like, well, my dose is ordered at 25 micrograms. Is there a reason? Sometimes there might be a legit reason. The doc is really worried about airway compromise. The patient may already have gotten medication that's making them a little more sedated. They came in by EMS and they got fentanyl before they came. So then the doc is like, I just need a little bit more. I don't want to do too much because then you can cause respiratory depression and other issues. So it is beneficial to approach your doctor and be like, hey, I'm calculating a safe dose of a therapeutic dose of 45 to 60. Is there a reason for doing right about half of the low end there? Because they're human, right? So they make mistakes. So you want to just double check that with them. All right, cool. Okay, so then that's kind of my spiel on that, is how do you know when to approach your doctor if it doesn't fall into that therapeutic range there. So then how do you calculate how much you're going to give? So let's back up here a little bit. Let me erase this without losing my whiteboard. Okay, your concentration for fentanyl is normally 50 mics per ml. Some of them will be 100 mics per ml, some are a little different. So just make sure based on your location that you know what your concentration is. So for mine, it's 50 mics per ml. So we're going to do the 25 mics, right? So we found the IV version is the normal dosage, the safe range is 15 to 30. Right? So we're done with that. We know that this is a good dose, that this is going to work, and that it's going to be effective, and it's not overdosing the kiddo. Okay? So now what we're trying to figure out is how many milliliters am I going to give of the fentanyl? Okay? So again, what do we know? We know the doctor's order, right? The doctor's order is 25 micrograms. And what else do we know? Right, we know the concentration because that's from either your pharmacist on the vial of your fentanyl or it's on your drug formulary as well. And that's good places to look for all that stuff on there. Pharmacy is another great resource. If you're ever struggling with medications and calculations, just talk to your pharmacist. They're geniuses. And they do really, really well with math, which has been a lifesaver, especially in code situations, high stress situations where the math doesn't come super easily for some of us. We want to double check these medications and make sure that they are right. And a pharmacist is a great, great resource. Okay, so we know our concentration. Sorry if you can't see that. So it's 50 micrograms per 1 milliliter is our concentration, right? Okay, so let's write that up here. Let me switch to a different color here. So if I just write that how they give it to me from the pharmacy, do you see the problem here? What do we need to cancel out? Yeah, we need to cancel out the micrograms. You can't cancel out micrograms when they're multiplied directly across. It becomes micrograms squared. And that ain't gonna help. So then, what we need to do then is flip one of our fractions. Okay, so we're going to go mLs on top, that's 1 ml, over 50 micrograms. Because what do you want at the very end? You want milliliters left at the very end. So the goal is, it's just like, what do you know? what are you trying to get? And what are you trying to figure out at the very end, so that way you know how much to draw up of the medication to give. All right, so then do the micrograms cancel out? We can do this here just to give us another fraction on there. Another way to do it is, if you want to still write it out as 50 micrograms per ml, just flip this one and go 1 over 25. And that'll still get you the same answer on there. I just like having it so my doctor's order's there, then I'll flip-flop around my concentration to whatever I need it to be. So then 25 times 1 is 25, right? Then you have to divide it by 50. So 25 divided by 50, go ahead and do the calculator there and see what you get. Cool. Okay, so what you should get is 0.5. Hopefully that helps with the little bit more complicated math on that. So that's your fentanyl there. All right, let's do one more. Okay, so it kind of helps solidify this. This one's going to be a little more complicated here. So we're going to do Rocephin. This is a common antibiotic. They give it intravenously. The other name for it is ceftriaxone. So your provider orders Rocephin, and they order it as 2 grams. The weight of the patient is 110 pounds. What do we need to do first? Right, let's switch that over to kilograms. We don't like the pounds version. We want the metric version. Okay, so 110 pounds, right? Okay, so we're going to go 110 pounds. Do you remember how many kilos in pounds? How many pounds are in each kilo? Right, 2.2 pounds in 1 kilo. Okay, so what do we want on top? What are we trying to end with? Right, the kilograms. Okay, so we're going to put kilograms on the top, and then we're going to put pounds on the bottom. And then we end up with kilograms over here. Oh, I'm stretching. Okay, so we want to go 1 kilogram, 2.2 pounds. Go ahead and do that math and see what you get. 110 divided by 2.2. Good, cool. All right, so you should have gotten 50. So 50 kilograms, right? All right, so we don't like pounds. Get rid of pounds. Erase it all. Get rid of the pounds. So we're going to write 50 kilograms up here just to replace that. Okay. So now that we know our weight in kilograms, now we know from your drug formulary what is your therapeutic dose. Rocephin is most commonly given as 50 to 75 milligrams per kilogram per day. However, there is a note in here that says it's divided into doses 12 to 24 hours. So what that means is it's either once a day, 24 hours, or twice a day. Every 12 hours you're going to give it. Okay? Majority of the time it's like a one-time deal. Unless they're super sick, they're going to give them twice on there. But then you got to split this so that way they don't go above the max dose on there for the day, which we'll get to that in a sec. Okay, so 50 milligrams per kilo per day. Okay, so let's go to deciding which color I want. Okay, so 50 milligrams. Oh, that's bad. Let's do this one. There we go. 50 milligrams per kilogram. Okay, so what are we trying to figure out? We're trying to figure out how many milligrams is a safe range here. Okay, so 50 milligrams. And then you're going to put your weight over here. So where do we put the weight at so that we cancel out on there? Right, so it's going to go on top. Okay, so 50 kilograms, which is just the weight over here. Don't let it confuse you with the safe dose here, the 50 milligrams. Okay, this is where you got to really make sure you're getting your numbers plugged in right. Okay, so your weight is over here, your safe dose is over here, the low end of your safe dose. Okay, so 50 milligrams times 50 kilograms, so your kilograms cancel out. So 50 times 50, what do you get? Right, so you should have gotten 2,500 milligrams. Okay, so then the other one, okay, so here, let's do this. Let's write this up here. So now we know our low end, 2,500. Now all it is, this is an easy way to do this. Scratch off your 50 over here. Well, let me erase it with the actual eraser instead of my finger. So 50, so then just replace it with your 75. Then what is 75 times 50? And that gets you your high end. This one I can't do in my head, so I got to do the calculator. What'd you get? You should have gotten 3,750 milligrams, right? Okay, cool. So that's your range on there. So then, now your next thing is, well, my doc only ordered 2 grams. Well, how many milligrams is that? Hopefully that should be fairly easy math, but just in case it's not, let's do this. So we're going to go 2 grams, right? And then what do we want at the end? We want milligrams, right? So then we're going to go milligrams here. Whoops, I didn't give myself enough room. Milligrams there. What do we want at the top of our other fraction right before it spits out at the very end? Right, we want milligrams here, right? Okay, then how do we cancel out the grams? Yeah, we put the grams on the bottom. I'm going to just do G for grams, okay? All right, how many milligrams are in 1 gram? Think back to math in high school, middle school, elementary math, because these ones are the ones that you just have to remember. So there are 1,000 milligrams in 1 gram, okay? Now it gets really confusing when you're starting to try to go micrograms to grams and yeah. Again, but then you just break it out. This is like, okay, I know there's 1,000 micrograms in 1 milligram. Then I know that there's 1,000 milligrams in 1 gram. And then you just break it out and cancel it out. We'll do that more into once we get into like micrograms per kilo per minute when we're going to do the drips in a different video. So then we're going to do 1,000 milligrams in 1 gram. So that's just a simple 2 times 1,000. Hopefully you can just do that in your head. But if not, this is an easy way to do it here. And that's totally okay, especially if you're brand new. You want to make sure you're getting it right, okay? So, and it is totally okay to take your time to write these things out until you get comfortable with it and you see it enough times. Then you can start doing it in your head and be like, oh yeah, I know 2 grams is equal to 2,000 milligrams. At this point, I don't even need to write that out on there. Now, if I'm doing micrograms per kilogram per minute and switching all that stuff around, I'm still going to write that out no matter what on there, okay? Because it is very complicated and you want to make sure everything lines up just right, okay? So then you have 2,000 milligrams. You may have caught it already. Wait a second. My therapeutic dose is 2,500 milligrams to 3,750. Why is it at 2,000 and not up higher? Especially with an antibiotic, they shouldn't have gotten one before you gave it. Maybe they did, maybe they didn't. But again, you should only be doing this 1 to 2 times a day. So then that dose should be up higher, right? Wrong. This is where the max dose comes into play here. So did you know that max dose, this is where you're going to get this from the drug formulary, is what is my max dose? On your drug formula, it's going to tell you exactly how high you can go before you're done. And you can't go any higher. Because if you get somebody that's, say, in the adult world, that's going to be 300 pounds, you can't do this because then you're going to be way, way over that 2,000 milligrams on that there. So on your formulary, it should tell you what your max dose is on there. And I'll tell you on mine, it is 2,000 milligrams. So then that's why it stops at 2,000 milligrams, and that's why the provider only ordered you the 2 grams. They're not going to order you something in between this range here because the max dose is 2,000 milligrams. Hopefully that makes sense there. Okay, now you know your dose. Now the doc says, hey, well, how you know, like, how do I give this? It's an IV medication. But do I just push and slam this through? Maybe, maybe not. But your concentration that you also got from either your pharmacist or your drug formulary says your concentration is 40 milligrams in 1 milliliter. So then now we need to figure out how much I should be expecting from pharmacy, or how much, if I'm reconstituting the medication and mixing up my own medication, how much should I expect to have at the very end? So this is your concentration here. They say to infuse it over 30 minutes, which we'll get to in a second. So I got to figure out how many milliliters am I going to have of 2,000 milligrams, okay? So again, what do I know? I know my dose is 2,000 milligrams, right? I know my concentration is 40 milligrams per milliliter. What am I trying to get to at the very end? I want to get to milliliters, right? So at the very end, that's what I want, but what do I know? So you're going to have 2,000 milligrams. Again, this is just my preference of writing the doctor's order first of what they ordered on there. And then you put in your concentration. But hey, you're catching on here, so you know you need your milliliters on top and to get your milligrams canceled out. So you're not going to write it out this way here. What are you going to do? You're going to flip that fraction around. So we're going to go ahead and put it 1 ml over 40 milligrams. Okay? Do your milligrams cancel out that way? Yeah, absolutely. Perfect. Good. And then you're left with milliliters. Can you go ahead and do that math there? 2,000 times 1 is what? 2,000, right? That's easy. Okay, 2,000 divided by 40, what do you get? You should have gotten 50 mLs. Okay? Am I going to sit there and push 50 mLs? I could. Is it going to be beneficial to the patient? Probably not. There's a reason that they told you to infuse it over 30 minutes. I'm not going to sit in a room for 30 minutes. I got other patients to go see, right? So this is where a pump comes into play. Now, depending on which pumps you have, some of them automatically program it and everything. That's all great and dandy and stuff. However, you want to still make sure that your pump is correct. Because at the end of the day, your pump is a machine. Use it. That's great. But your pump can make errors, and you don't want the error to fall back on you because you didn't do your math and make sure your math was correct on there. So now I got to figure out, how am I going to put in 50 milliliters in over 30 minutes, right? Okay, so we're going to write 50 milliliters there. That's how much I have. That's 2,000 milligrams or 2 grams, right, of Rocephin. Okay. Then here we're going to go. So again, what do I know? Well, I know that there's 60 minutes in an hour, right? Your pump probably is going to be something in milliliters per hour. So we need to figure out, how do I get to milliliters per hour? Some of them may do milliliters per minute. Mine don't, right? So most of them are going to be like a milliliters per hour is what you need to get to. So before we do that though, what do I know? I know I have 50 milliliters of fluid that I need to give in, right? Okay. So 50 milliliters, how fast does the doc want me to give it in at? 30 minutes. Well, where does that 30 minutes fall into at? It goes right here. You're going to go 50 milliliters over 30 minutes. Okay? So then, that's how fast they want you to give it. And that's totally 100% appropriate to give that over 30 minutes on there. But the problem is my pump only does milliliters per hour. So I can't program in 50 milliliters time over 30 minutes because that's not going to give me the right number. Okay? So then what do? So I know I need another fraction, at least one other fraction in there. Again, when I do the micrograms per kilo per minute, there's going to be a whole lot more fractions on here. But for simplicity, I know I need one more fraction in there to get to milliliters per hour. I already have my milliliters. Cool. That's going to go all the way across, right? So at the very end, I need to have milliliters per hour. And it should be over 1 hour, right? Because if you have more than 1 hour down there, then it's just going to be super confusing. We want to know what your rate is over 1 hour on there, okay? So if I need to convert this from minutes to hours, how do I do that? How many minutes are in an hour? 60 minutes, right? Yeah, cool. Now how do I cancel that out? Where does my minutes go at in this fraction here? Do they go on the top or the bottom? So I'm trying to cancel that minutes out, so it's going to be diagonal to it, so I know I'm going to put my minutes over here. Right? Okay. And then I know it's going to be minutes per hour. HR is hour. So then I know that there's 1 hour, right? I need to figure out, so then how many minutes are in an hour? 60 minutes, right? So then I go 60 there, okay? Now I got to do the math. So I do 50 times 60 divided by 30 times 1. If you want to do it, you can go ahead and divide the 50 divided by 30 and then multiply that times the 60. That's totally fine. That'll get you the same answer. However, I just like to multiply everything all the way across on top, then everything all the way across on the bottom. And you'll see where this gets important when you're starting to do your micrograms per kilo per minute. It makes sense in my head, and however it makes sense in your head, that's totally fine. Just make sure you stay consistent so that it's always the same every time. So if you want to go ahead and divide each one, simplify your fractions, and then multiply everything all the way across, that's fine. Or if you want to do like how I do, multiply all the way across, and multiply all the way across, and then that's your final fraction, and then divide, and then it gets you your answer there. So 50 times 60, what do you get? Right, you should have gotten 3,000, okay? But you're not done because you still have the 30 minutes, okay? So then 30 times 1 is 30, okay? So now you have a fraction 3,000 over 30. So then if you do 3,000 divided by 30, what do you get on that one? Right, that's 100 milliliters. 100, so then just to double check your math and everything, you want to make sure everything cancels out. So your minutes cancel out there. You're left with milliliters per hour, which is exactly what you want at the very end. So you're going to make sure your pump is programmed for 100 milliliters per hour. Now, does that make sense? I'm going to give 50 milliliters over 30 minutes. If I was to do it over an hour, and there was like, how much is that going to go in over an hour? It's double, right? Yeah. So your math, you just want to, when you're done with it, you just want to make sure it makes sense. If this somehow came out and said, I'm going to do this over 1,500 milliliters per hour, something's not right. You're like, no, 1,500 divided by 2 is 750. I'm not going to give 750 milliliters in 30 minutes. Does that make sense? So like 100 milliliters, if I divide that, because I know it's 100 milliliters is going to go in over 1 hour. If I divide that by 2, because 30 minutes is half of 60, then that gives me my 50. So hopefully that helps you a little bit and it kind of makes a little bit more sense of the math on pediatrics. I'll do another video that is much more complicated with the micrograms per kilo per minute. If you have questions, let me know. I hope this helps. If you like it, give me a thumbs up. If you don't, please let me know so that way I can figure out how to help you and where you're struggling at with the math, and that it just kind of helps to make things make more sense with it all. And give me a thumbs up, like it, subscribe to the channel. I got lots more videos coming your way. Have a great day.